Okay. So what actually you all want to know, apa yang you all nak tahu is for the our side lah. For this side.
We would like to know about the topics that we should really cover for the OSCE, as well as what should we expect for the SBQ? Yeah.
Yeah, yes, SBQ also have lah. Okay, but it's actually part of others as well. So in SBQ under medical, kan, medical side. So you will have another SBQ for the surgical side. So from our SBQ is just you already go through the semester exam, right? So the SBQ is just similar as a semester exam. It's just you all group yang
It's like a
OSCE.
non-interactive OSCE question, right?
Yeah. It's just like the non-interactive OSCE question. You all go through the written OSCE in the semester?
Yes, doctor.
Yes. So the SBQ is just same as the written OSCE, which is you don't see the examiner, but the question is just same as OSCE written.
Yeah, you will be given a scenario and then questions according to the scenario. Yeah.
Yes. There are a few parts of a question you need to answer based on the scenario given. So the scenario is actually something that you already learned in the posting, and it's just a common problem, which is we already listed in the kalau you notice that during my briefing when you go through the posting, during my first briefing I listed already what are the things that you should know. You should know at the end of this posting the topics, because that actually the main question that will come out from that topics. You all ada go through tak? Ada pernah?
No, doctor,
You want me to
because
show?
yes, sure, doctor.
Okay. Wait. The topic is just that. So the question is mainly from that topic. So we actually narrow down because the family medicine is too broad for you, isn't it? But we already narrow it into a few topics that you not a few lah, banyak juga kan. But the topics that you should know and you should learn, because that will be asked in the exam questions. Okay, wait, just show you. Anything else they want to ask? Because Dr. Ying also with us, so maybe both of us can.
You already know there's just one OSCE question from Family Med, right?
Yes, doctor, but we're not sure what to expect.
So this is the topic that you should know. Yeah. So this is the topics that you should know, and we will ask in the exam just this list the topic that we already listed for you to learn. So this is the things that we will ask in the exam as well. Okay. Can you all dah remember kan to refresh back your memory, you open your memory. Okay, so that's the topic. Actually, we will ask. So in the question, that's the topic that could be come up. Okay. Anything else? So SPQ is just like a written OSCE. For the OSCE, you will have same OSCE like you went through during your semester exam. So the OSCE question would be same as semester exam. It's just as similar.
Yeah, it just like last time, it can come out like history taking or consultation or procedures or prescription. Basically, it's this kind of questions for the OSCE. Yeah.
Maybe you need to perform something, you need to perform the procedure, what we actually learned during the practical skill, and all the procedure that we actually listed in the logbooks, and yang you observe, you perform during the clinic posting tu, that will be come out in the exam jugalah. So that's the procedure lah usually. Okay. Kalau history taking, it can be anything kan, but it's still according to the topic that we actually listed to you, that should know topic usually. Okay.
So remember to read properly the instructions and what actually are required require you to do lah. You need to read properly. Yeah. If history taking, the patient presented with any symptom, and then further history until you can get the diagnosis, roughly a professional and differential diagnosis. Yeah. If consultation, then usually it's mentioned in the scenario and what type of consultation that you need to give to the patient. It can be in a child health, human health. I just give an example, not necessarily come out like pap smear consultations or NNJ like immunization, anything can come out. Yeah.
Yeah. So you need to read properly the OSCE question, because you only have 10 minutes. So 10 minutes is quite short kan. So you have to focus. If the question asks you to perform, then you need to perform straight away. But still you need to give you need to greet your patient, you need to introduce yourself. That actually include for the marks juga. Okay, so introduction, no need macam rush sangat kan sampai you tak greet the patient, not introduce yourself, and then it's just too rough with your patient. So that actually will be counted in your marks. So you need to focus on that as well lah. Even though you maybe the adrenaline is too high at that time kan, but still you need to greet your patient. Okay, even though you are in a rush position kan. So you kena ni jugalah. Okay.
So usually OSCE, there is a mark for the professional skill, how you handle the patients, how is your, is it you greet the patients, thank the patient at the end of any consultation or procedures. So remember to do it for every OSCE station. Okay.
And then if you want to give instruction, please give instruction properly, clearly, so that the patient could understand what you want to do. Okay. So if you educate, if you need to counsel or give education to your patient, then you need to educate your patient clearly. Okay, clearly that, and then use the simple words that the patient can understand. Okay, do not use the medical jargon or medical term. If you want to use the medical term, yes, it's okay, but you need to explain to your patient. Okay, if you want to use, because you cannot remember how to change the words, right? But then you have to describe clearly to your patient lah in a layman term. Okay, that's the tips lah for the counseling or patient education. And you can draw something if you not sure whether your patient understand what you actually inform kan. So you can draw, use a paper in front of you that you can use lah. Okay. And then please do not ask examiner how I perform. Okay. Hi, how I perform, how about my marks? You cannot ask the examiner that way lah. Okay, examiner will be communicate with you if the examiner wants you to give the facial diagnosis, for example, kan, ataupun examiner wants you to give something that they need to to ask you, okay, to give you marks. Okay, so you need to answer that. Okay. So that's the OSCE part lah. So 10 minutes is quite short. So you need to be quick juga lah. Okay. So and then read the instruction properly. Anything else?
Yeah,
I would like to ask a question.
Mhm.
For example, if we are given the task to counsel regarding contraception, so when we give the counseling, so how do we go about it? Do we tell each detail regarding the options that are available for the contraception, and what are we expected to explain? Are we expected to explain as well regarding how they have to do each contraception and how many medications they need to take? Is it something like that, doctor?
So contraception usually we narrow down lah. We not give you a very broad advice on contraception. Usually the patient already know what they want, kan? So the first thing you need to ask the patient which one you prefer. Which one you prefer? Are you prefer pills, injection, or the intrauterine device, kan? So you need to ask the patient because the patient will tell you the clue, kan? So when the patient say that I want the pill, doctor, then you already narrow down your advice or your apa counseling regarding the contraception because the patient is prefer for pills, kan? Kalau pills, then you assess the contraindication, okay, whether the patient is suitable for that pills or not, right? Okay, so kalau pills, there are two pills, kan? The combined and also the progesterone only pills. So you need to assess. So kalau patient request for pills, for example, kan? So what are the thing that you will ask? Satu, you ask whether patient prefer yang makan every day or kan ataupun makan 21 days. And then another thing you need to ask is patient breastfeeding or not, right? Because that will determine the suitable contraception for that patient, kan? Okay, so that are the things that you have to go about lah. Kalau been asked about the contraception. Okay, so you need to ask the patient regarding the contraindication. So you have to remember the contraindication for the contraception, especially for the COCP, right? COCP and other contraception methods. You need to remember that because it's not only asked in the family medicine posting, but in family medicine, but also in ONG, kan? That's something that you need to remember lah. Not only in family medicine only. Okay, so kalau you got the similar similar question regarding contraception in the ONG ke, kan? So you still can answer that question lah. Because so you remember that contraindication for family medicine and also for the ONG. Okay, so I'm going to ask about the insulin. Okay, this I'm going to ask counsel on insulin. Okay, so that's after this we'll discuss about the insulin. So anything else about the contraception? Badrul, are you okay with that?
I think okay, doctor.
Okay. So everything kalau you need to counsel about the contraception, first thing you need to ask the patient preference first, right? Okay, so the patient will give you a clue. Then you can go about lah. If the patient said I want long term, apa yang long term? Biasanya ICD kan, implanon. So that's actually give you the clue lah. Okay.
And then also patient previous experience of taking any contraception, actually you can ask, is it previously already history of taking pills, any problem with the pills, you can ask. And then if really the patient already choose to take the OCP, then you need to tell patients how to take the pills. how to take the pills, and then if miss pills, then how. It depends on, usually the SP will, how to say, will guide you lah to, sometimes will guide you where to, I mean what to talk about. Sometimes we divide we will provide the question to the SP, and we will to ask the students also have. Okay. I have problem with my video. It's okay lah. Okay. There is a question in the chat.
Question. Okay, so we finished about the contraception, right? Okay, so hopefully you, if contraception come out kan, so you can answer that way lah. Okay. So you are in a good line lah. Kalau contoh, you been asked to counsel, then that's the thing yang you need to need to have in your consultation, right? Okay. So that's about the contraception. Okay, so Amni asks about example, in OSCE, we need to counsel patient on insulin. What are the things we need to assess for compliance to insulin? Besides asking any dose and what time the patient take the insulin. Counsel patient on insulin. Counsel insulin, usually counseling, because it's actually in the practical skill, right? When you are in a family medicine posting, the insulin, we actually ask you to counsel your patient regarding the usage of the insulin. Usually, we will ask you that. Okay, the usage of insulin, and then what you need to counsel. Okay, compliance. You need to comply. What other thing you need to assess for compliance to insulin? Okay. So compliance, but because when you counsel regarding the insulin usage kan, so you need to inform the indication why you actually started the insulin kan, and then you need to know what type of insulin that you want to use. So usually in the question they will, we actually give you already kan the insulin, what type of insulin, let's say insulatard or atropine. So you already know what type of the insulin is. Okay, insulatard tu insulin apa?
Long acting.
Intermediate. It's not long acting. It is intermediate. Long acting only for the analog part lah, glycine. Okay, kalau insulatard tu dia human insulin. So it is the intermediate. Okay. So kalau intermediate, kalau human insulin, what are the thing yang you kena advise regarding the usage tu? Biasa kita ambil waktu bila? Bedtime kan, kalau insulatard usually.
10 p.m.
Yes, PM or night kan, bedtime. So you have to advise the patient to take the insulin at night, and then usually it will take they kena ambil meals about 30 minutes before the injection usually. Okay, especially on atropine lah, tapi insulatard pun the same thing lah, because the action of the insulin, human insulin kan, they need to take before meals. Okay. So apa lagi? Counsel assess compliance. Compliance tu you need to macam mana you nak assess compliance dengan insulin. So you kena tanya timing dia, siapa yang inject dia, how about who actually monitor the medication, and then you ask follow up dia. During the follow up, the medication already finished or still have the storage kan. So maksudnya kalau still ada storage, meaning that patient did not use the insulin lah. Okay. Because the storage is masih banyak lagi kan. In large amount, maksudnya dia not using the insulin. What else yang you kena assess the compliance. And then you see how about the control kan, SMBG, if the patient did the SMBG at home, so you can see the SMBG whether it is control or not, or if you see the SMBG is too high, meaning that the patient might be not use the insulin lah, but still you need to ask in detail lah. about that. How many units when you inject the insulin. So you should know lah, yang macam insulatard usually at bedtime. But some patient they actually inject during the morning kan. So because the misunderstanding of the timing lah. Okay, so you need to assess that. Okay, that's the assessment for compliance lah. Compliance insulin. Kan? Dr. Ying ada apa-apa nak tanya, nak tambah tak?
Yeah, basically for the compliant, you can ask directly and indirectly lah. Is it you can ask the patient like, do you take the insulin every day? Do you ever miss any insulin? So I think by asking these two questions, actually, if the patient answer no, I mean didn't miss at all, so means very compliant lah. But at the same time, you need to assess why is it still not control. What is the timing? You further ask the question like what is the timing of taking insulin? Who helps the patient to take the insulin, or patient can take the insulin by him or himself. Okay, and then yeah, I think that one and then you need to ask where the patient inject the insulin, also very important lah, the injection site.
Yeah, how many times they change the needle, that you can ask how many times they change the needle. And then Alia asked, should we counsel patient on titration of insulin too? Yes, you can counsel that they need to increase the insulin every 2 units kan, but it is important for you to assess whether the patient did the SMBG or not, because if they just increase the insulin without doing the SMBG, it's too dangerous for them juga lah, because they get risk of hypoglycemia. Please remember about the hypoglycemia. You need to advise the patient regarding the hypoglycemia event that the patient might have if they inject the inject the inappropriate timing and also inject the inappropriate dosage kan. So you need to advise regarding that, and then you can advise juga how they need to do how they need to do if they got hypoglycemia kan. That's the other thing lah. You can advise what they need to do if they had some symptoms of hypoglycemia, so what they need to do. So you can advise that lah, counseling on that. Tapi usually in 10 minutes it's quite you have to go fast lah kan, sebab because for counseling for insulin is quite banyak jugalah. Usually we will ask in the postgraduate.
Yeah.
But postgraduate for you all usually you have to mention regarding the usage. Let's say patient yang initiate, yang kita baru initiate insulin. Apa yang you kena cakap? So about the insulin use lah, yang about the insulin pen, how to administer. Okay, for your level usually that lah, we will ask.
The technique of insulin injection, right? Yeah.
Yes, the technique.
If really come out titration, I think the question will be straightforward lah. Please, I mean, educate the patient how to titrate the insulin. Then you look at the scenario, see the patients on which type of the insulin, and then ask about the SMBG, and then if not control, then you can ask the patient to titrate. Yeah.
Okay, any about TB? Jasmine Farisha, okay. Let's say the patient develops side effect of joint pain from pyrazinolamide. Should we stay with the regime or add on analgesic? And for the isoniazid, do we give the supplemental pyridoxine? Usually we give
So
at the
specific.
clinic. Yang ni for the TB, so usually tak come out lah in your dalam you punya OSCE lah about the TB, this one. Tapi pyrazinolamide memang kita akan bagilah for those yang on anti-TB regime. Usually kita bagi untuk prevention, untuk prophylaxis. So memang kita bagi. Cuma kalau yang side effects of pyrazinolamide tu, you kena tengok jugalah. It's not your level lah for me. Untuk yang you want to counsel regarding that. This is unfair lah to ask you all in the OSCE. Biasa kita tak tanya lah about that.
Yeah.
Yang TP tu.
Side effect joint pain because of increased uric acid, is it? After started the pyrazinamide.
Paracetamol.
Yeah.
Tapi yang ni is mainly when you already when you already manage the patient. So usually we don't ask. But in postgraduate exam, we might ask that. For your level, we don't assess in the OSCE lah. But for your knowledge, for example, for SBQ, for your SBA or multiple true false, they can be come out about that.
Sure. Pyridoxine straight away give. After if we start isoniazid, then we straight away give. Yeah.
Yeah, as a prophylaxis, then we give. So anything else?
Another what Dr. Tina asked, Doctor, what are the common performing questions that we should know? For example, what procedures, Doctor?
Procedure is listed in your logbook. You all
Yeah.
ada tak? Ada copy tak logbook kita orang?
Adult health, human health, child health.
Yes.
Adult health, example like what?
Blood
Insulin,
flow,
MDI, what else?
blood flow,
BMI,
BP,
peak flow.
apa lagi? Apa ni? Anthropometric measurement, height, weight. Even though you rasa macam simple kan?
ECG.
Simple tapi it can come out as a procedure kan? Macam ECG setup ada dalam you punya logbook kan? You pergi observe and then you actually perform kan? Kalau tak keluar dalam family medicine, usually they will come out in the emergency ke kan? Macam ECG setup tu. You need to know jugalah. Dalam emergency ke, dalam medical ke, they can become out because that the common procedure that you should know lah as a
If human like pap smear, what else?
yes, the woman
Child error chamber,
Error chamber.
endoprometry measurement. Yeah, these are the common procedures skill lah.
yeah, usually come out lah.
Endoprometry, MDI, yes.
Trigonometry, MDI. We don't have logbook with us. So you all tak ada copy hari tu? So you want me to show your logbook? Okay.
Yes, doctor.
Okay, to refresh the memory, right? Okay.
Yeah.
Wait, I try to show you. Sebab dah lama tinggal, about 1 year, isn't it? Okay. I show you the procedure part. Okay. Can you all see?
Nampak.
Okay, so this is the procedure. Okay. So the procedure, this one, observe, perform, can incision and drainage, toilet and suturing, removing of foreign body, cleaning, okay, then dressing wound, administer IM injection, okay, administer subcutaneous insulin injection, removal sutures, others, okay. Okay, so yang ni peak flow meter, inhaler with or without air chamber, blood pressure measurement, glucometer. Okay. Ni waist circumference, height, weight measurement, BMI calculation. So you have to know the BMI formula. Okay. So which is you think very simple, but then when come out in the exam, so many people cannot cannot actually calculate because of the problem with the formula, kan? So remember the height you should change to meter. It's not centimeter, right? Okay. So weight divide by height, kan? Dalam kuasa 2, kan? Okay. So please remember that. Okay, so perform ECG. Okay. So this is part of your procedure. Anthropometric for child health, anthropometric measurement, neurodevelopmental milestone assessment, neonatal examination, 1 month for baby, immunization. Immunization usually to observe only lah. So usually kalau observe only tu meaning that we unfair for us to ask you in the exam lah to perform. Okay. So yang ni is women health. Okay, urine dipstick, tetanus toxoid, observe only, OGTT, fetal kit chart, abdominal examination in antenatal. Ini ultrasound, clinical breast examination, pap smear, implanon, Depo-Provera. Ini ear, syringe and toilet, testing visual acuity, testing vision color and fundoscopy. So it's just a similar. It's just a simple procedure which you actually did in the ward, kan? In medical ward, in ONG ward or ONG clinics, kan? It's just a same thing, okay? Cumanya kita akan tanya in the exam. Okay? That's the procedure that you should know and you should you should know on how to perform. Okay, because that's the list of the procedure that we will ask in the exam. Okay, what you already go through. It's not something that out of blue tiba-tiba keluar kan, tak. That's actually the things that you already go through, that you already did in the ward, also in the clinics. Okay, so that's the procedure lah. Okay. Okay, so finish about the OSCE. Anything else about the OSCE?
Doctor, I would like to ask regarding neonatal examination for family medicine, how is it different compared to pediatric? As in, what do we need to cover for neonatal assessment for family medicine?
It's just similar. So you need to repeat as examination of neonatal. So same thing. If you see in the postnatal ward, right? Postnatal ward usually the pediatric medical officer, usually they will go around kan for examination of the neonatal before they discharge the baby to the mother kan. So the examination still same as the examination of neonatal in the ward before they discharge the baby in the postnatal ward, sama. Because you are repeating the same thing. In the clinic also, you need to perform that examination as well.
Yeah, usually in the clinic is the 1 month old baby lah. But sometimes if any lady that delivered at clinic, we still need to examine like the newborn examination. Actually, it's just the same. Yeah.
Same thing.
Just
You
maybe
kena assess juga lah.
newborn baby there is an umbilical, but 1 month old I think usually the umbilical no umbilical stump already lah.
But you still need to observe the umbilical part because
Yes.
sometimes the umbilical it got infected. There's a past discharge. Sometimes not it's not well healed kan dekat umbilical area. So you still need to assess that. Especially kalau patient ada prolonged jaundice ke, then you need to assess the umbilical part juga lah. Kan? So it's just the same part you need to assess. First thing you have to go through the inspection because sometimes in the postnatal ward they will miss they will miss a few signs kan. So during 1 month old baby we need to catch that miss sign during the postnatal examination. So same thing lah, you kena perform yang balok otolani test tu you need to do lah. And even though dah 1 month old, you still need to perform. Okay. So sama. Okay. Number question you cannot know the number of question lah sebab you tak boleh nak differentiate pun when the ni because it's not
Many
separate.
question, is it?
Ah,
Actually,
how many question?
SBA.
SBQ, OSCE, long case, short case. Number of question, we cannot tell you all lah the number of question, but cuma yang I can inform you that we have one OSCE lah for you all. Okay, long case, short case, we cannot tell you how many because it depends kan. Everyone will get because we are under medical side. So if you got long case for medical side, then you will get the cases from family medicine, pediatric, from medicals, kan? Same thing. So we don't know.
Pediatric.
Pediatric, you will get that kind of cases. And psychiatric, psychiatric also under medical side. Okay. How many question in SBA, SBQ, we cannot tell you all because it's actually include with other department as well juga lah. So dia termasuk dalam medical lah, SBQ for medical, SBA tu as a whole lah. How many tu kita tak boleh beritahu. Okay.
Then for the short case, if you get the long case from surgical side, then you will get a short case from medical side lah. Right. 2 short case. Usually it's one from family med and then a pair with another medical side or pediatric side. Yes.
Putri Balkis, Dr. from FAPMED OSCE next week is non-interactive session, right? No. OSCE meaning that interactive. For OSCE, usually interactive. So you will have the examiner with you in the room. Okay. So OSCE for professional exam will be interactive. Salam, good morning. Long case, do we need to standing and lying blood pressure or just do as usual? Thank you, Doctor. For long case, you need to do both. Better to do both than standing and lying because you have 1 hour with your patient. 1 hour for clerking, for examination, for long case. So you can do according to what cases that you got lah. Kalau patient diabetic, usually you will have to do standing and lying kan. Kenapa kita kena buat standing and lying?
Check for postural hypertension.
Why they got postural hypertension?
Kepada apa yang orang tanya?
The drugs they take, doctor.
Yes, about the drugs and then sometimes dia orang dapat autonomic neuropathy, they will
Orang tanya
get
long
that
case pula.
postural juga. Okay. So long case kita orang sama macam what you have presented during the clinical teaching. Same.
Ni kalau long case.
Eh?
If complain patient come for exam lah.
Yes, sebab dalam long case dia tak ada direct. You all memang akan dapat patient yang macam tu juga.
Kan
From the
family
other case,
patient come for follow up.
yes, dia akan datang for
Tak.
follow up. Siapa tu? Irfan eh?
Tak clear.
Tak clear.
Terbuka mic dia.
Okay.
Tak,
So long case
tapi-
especially, kenapa?
Tapi doktor,
Yeah.
kalau patient kan dia datang untuk for exam, so kita cakap dia datang for follow up ke?
You kena tanyalah patient tu datang untuk apa. Kalau dia kata for the exam, you have to mention, okay, patient come for the exam. But this patient have list the problem. Sama juga patient medical pun memang diorang akan datang for the exam purpose ataupun patient in the ward. They can choose any patient that actually suitable with you all. Macam contoh, let's say you dapat patient thalassemia kan in the medical kan. Patient tak akan datang for admission pun. Sebenarnya patient datang for the exam purpose. It's just we want you to clerk the problem of the patient. So the clerking is same as you present during the clinical teaching. Sama lah, kena ada history of presenting illness, dia punya past medical history, past surgical history. But we actually learn during the clinical teaching. So same thing.
So usually maybe try to identify any acute problem from the patient first lah. If there is no acute problem, then is it this one is like a chronic cases? Is it come for follow up? Or usually because in the exam setting can you can just, if really no acute problem, then you can say patient with underlying what conditions, currently no active complaint. Yeah, can be the chief complaint. Yeah. Unless there is a acute presentations with any complaint, acute complaint. Okay.
So you need to present, let's say the patient complication, you cannot say just patient with no complication. You should spell out what complication that you actually asked the patient. The relevant negative, even though the patient did not have that symptoms, but you actually ask regarding the symptom. Let's say, for example, there is no chest pain, there is no autopnea, there is no PND, there is no palpitation, okay, for IHD. Okay, because we know that you're actually assessing about the acute coronary syndrome or about the ischemic heart disease problem. Okay, so we know that you actually asked that. Tapi you jangan cakap, okay, this patient did not have any complaints, full stop. Then you will not get marks more lah regarding that statement lah. Okay, so you have to spell out one by one because we want to know how you get the history. During the long case too. Long case, we actually assessing how you get that history from your patient. So it depends on the way you present the history that you get from the patient to your examiner. So you cannot just because a patient come for the exam and then you did not ask anything because you think that the patient doesn't have anything, any problem. You just come for the exam, no. Okay. Because usually, even though the patient has a chronic disease, patient is stable, but sometimes the patient actually have the problem. Kan? Macam contoh, perhaps they ada knee pain, they ada back pain, which is not sick for the treatment yet. But now she came for the exam, but actually she got the knee pain ataupun dia got problem with sleep, got problem with the shortness of breath, relaxation, reduced effort tolerance, who knows, okay? So please do not think that when the patient said, I come for the exam, then you don't want to assess more, okay? Because patient have a risk to get that, okay? So kalau patient have diabetes, hypertension, uncontrolled, so they will get the complication. Even during the clocking time, they will get the heart attack, okay? Please do not just simple ignore the symptoms, right? Sometimes patients say, I'm okay, I come for the exam, but then when you examine, there's a huge pitting edema, kan? Nampak macam very prominent pitting edema. So patient is actually in failure. Example like that.
Okay? Some patient tiba-tiba suddenly got rhonchi also.
Yeah, suddenly got rhonchi, suddenly got palpitation. Okay, who knows?
Then remember for the long case, need to need know the weight and the height of the patient, and please calculate the BMI. Can be one of the problem list lah. Yeah.
Yes.
So this one for BMI, want to use the WHO or Asian one?
You can
I
use
will recommend use the Asian one.
Asian. Sebab kita biasa kita guna Asian. How do we assess risk of fall in elderly patient?
And what to advise?
Assess risk of fall. We actually discuss kan dia ni risk of fall. So apa yang you biasanya assess? Anyone? Dah refresh balik your memory kan?
Patient's vision,
Yes.
coordination,
The geriatric giants, right? Geriatric giant, the imbalance kan. Ada apa lagi? Vision problem, medication, some medication, iatrogen,
Morbidity,
immobility, risk of fall.
incontinence.
Yes, all the geriatric giants actually you need to assess lah. Because we want to assess the risk. And postural tadi, please remember about the postural hypotension because you mentioned just now kan. Apa tadi yang kita kata okay, about the BP standing and lying kan. So kalau patient ada postural hypertension, they tends to fall. Ataupun patient on prazosin, so usually dia akan ada postural hypertension in the morning. So they will get fall kalau dia orang tak aware about it. Okay, so you can assess that lah. What to advise? What to advise actually according to what the patient has. You can assess dulu, then you can advise. Because we cannot just simply give but general advice you can always mention the patient that kena slowly wake up in the morning kan. Especially kalau patient ada knee pain pun boleh juga jatuh. So you need to assess lah. Good lighting, right? So banyak benda yang general tu you can advise. But for the specific one, it depend on the patient lah. What are the risks that the patient already have? Then you advise accordingly. Okay. Okay. What are the components we should counsel for postpartum? It is inclusive for the baby too. Is it inclusive for the baby too? Yes, both. Kan, postpartum. Postpartum, you need to advise for mother and also for the baby. Kan? Apa yang kita nak advise biasanya? Counselling for postpartum. Anyone want to try?
contraception, counseling.
Yes, it is part of postpartum advice. Anything else?
Education.
Breastfeeding counseling.
Yes, breastfeeding, the important one. Okay, breastfeeding, any breastfeeding problem, kan? You need to assess and you need to counsel. So you can assess any breastfeeding any breastfeeding problem. You can breastfeed your baby, how many times, the frequency, right? And then any problem with your breast, kan? So you can assess that. Okay, breastfeeding, contraception, anything else?
Postpartum care.
Postpartum care. Postpartum care macam mana? Apa yang
Example?
postpartum care? Example?
Ada patient's depressive status, health status.
Okay. Ramai yang tanya depressive symptom kan. So yes, it is part. Tapi the most important one apa? Selain daripada depressive tu. Okay, it is part. Tapi yang paling penting is actually you kena assess the hydration, the nutrition kan. Usually kalau postpartum ni, they will restrict the fluid, restrict the meals kan. So you need to advise to get a balanced diet, to adequate fluid intake because you are breastfeeding your baby. So you need to have a good hydration kan. And then yes, depression is a part of any stress, any depression, any support from the family kan. Yang tu that's one part. And then the other things you have to assess for any risk for purpura sepsis kan. Purpura sepsis apa? Kalau macam contoh dia postpartum 2 weeks ke 1 week kan. So you need to advise regarding the causes of purpura sepsis lah. If you get any fever, if you get any problem with micturition, urination kan. That's the common kan. Common
And the
problem.
lochia, right?
The lochia changes, become profuse or become smelly, post-smelly kan. So that's the thing yang you advise lah for the postnatal patient. Okay, and then after that, you assess the baby as well, how your baby, so your baby well or not, how many kilos, gaining weight or not, breastfeeding or not, kan? Any problem with
Jaundice.
handling, jaundice, handling your baby, is there any problem? Yang tu lah you kena boleh tanya yang about handling your baby, you can handle your baby yourself or you need support from the husband, from the family. That's the things yang you assess lah usually postnatal. And then
Another
you
one thing
advise.
is the DVT, the need to encourage ambulations and then the
Yes.
hydration, all those things. Yeah.
Because they had a risk to get pulmonary embolism, DVT, kan? Because they reduce the ambulation, reduce the fluid intake, they reduce the food intake, kan? They restrict. Kalau in Malay culture dia macam apa kita panggil berpantang, kan? Berpantang dan dia tak makan, dia makan very non-nutritious food, kan? So you need to advise to get a balanced diet because you are breastfeeding your child.
And if the mother is post cesarean, then need to advise on the wound care also lah.
Yes. Okay. So is it answer the one Fahmida? Okay.
What focus for dermatology?
What area?
A very broad question. It's a common skin condition that is represented to clinic primary care lah. Example like eczema, right? Eczema, scabies, hand foot mouth disease, impetigo. These are the common skin problems lah in primary care.
Yes, fungal infection. Common kan? Yang in medical pun they will ask, they can ask the
Same.
same thing. Same thing jugalah. So family medicine and medical and also pediatric is same in terms of the assessment, in terms of the management, usually it's not much different. It's not much different. It's just same pathway that we actually follow. So kalau you got the pediatric cases, for example, bronchial asthma in your long case, please remember that you need to assess the immunization status, the developmental history should be in your history lah, kan? Okay. So that's the for long case. Okay. Lim Bojing, okay. If for long case patient did not have active complaint currently, should we present the patient underlying chronic disease under HOPI or past medical history? You can present in both. You can present whether in a history of presenting illness or in the past medical history. Perhaps you prioritize which one. If you want to prioritize about the medical, so you have to emphasize about the medical, the chronic disease, the medical part lah. For the past medical history, you can spare for the other comorbidities. For example, the patient had history of, for example,
Emission, previous
Ah,
emissions,
yes, previous
or any
admission.
previous surgical procedures.
Any procedure then you put under past medical history lah. Any procedure, for example, patient did angiogram ke kan, ataupun any apa lagi yang operation ke, any operation, any surgical history, then you put under past medical history. Ataupun patient had problem already resolved kan, patient ada medical problem but resolved, it's just macam contoh patient had PTB and completed treatment kan, you can put under past medical history because patient already completed the treatment and did not have any symptoms of PTB already, so you can put under past medical history.
Yeah.
You can focus on other chronic disease lah because TB already treated. Okay. Okay. All right. So I think anything else?
Dr. How how to say patient compliant or not. From my understanding, if not mistaken, patient forget to take the medication only one time per week, still compliant. How many % of taking medication per week we consider as compliant?
Should be less than 80%. If less than 80% of
More than 80% consider compliant.
more than 80% consider compliant. Kalau less than 80% tu consider not compliant.
Like one times per week still okay lah if like miss 1-2 dose. But maybe more
Kalau
than
contoh,
that.
it depends pada how frequent the patient should take the medication kan. Kalau let's say the medication should be taken twice daily or thrice daily kan, 3 times per day. So if they miss only 1 or 2 times, so it's still not more. It is still not less than 80% if they miss only 1 or 2 times per week. Contohnya dia kena ambil medication for 3 times kan per day. But then dia miss ada 1 kali je, 1 dos je. Macam pagi saja dia lupa, pagi hari ni. Esok dia lupa lagi, pagi juga, 2 kali je. So is it not compliant? Kalau dia kena ambil 3 kali sehari ubat tu. Still compliant kan?
Unless
Kecuali-
the patient
Ah.
persistently didn't take the morning dose. Then it's not compliance lah.
If the patient
Okay.
forget to take medication, what should they do? To forget? If they forget to take that day, do they still need to take? When they remember or just take the next day? Yang ni depends kalau patient should take once daily medication kan. So if they remember, they just take on that day lah. Kalau contoh dia remember the same day. Contoh dia makan pagi tapi dia remember to take the medication in the afternoon or in the evening. So they can take that medication on the evening. But then for the tomorrow, they need to delay the taking of the medication lah. Jangan macam contoh dia ambil evening and then tomorrow dia ambil pagi. So you should advise patient to delay the medication intake lah. Delay sikit, jangan makan pagi jugalah.
So in this case, if the medication is 3 times daily and they forget to take the breakfast one, and by the time they remember, it's already 11 o'clock. So do they take 2 doses or just 1 dose of the afternoon dose?
1 dose only for the afternoon. They cannot take
Don't
to
double the
like
medication.
like the OCP cannot. COCP kan macam
Yeah,
we advise for
POCP dia boleh double.
Yes. For the medication,
Antihypertensive or
hypertensive.
oral glucose lowering drug, then it's not recommended to do that.
Yeah. Because of
Even
side effect.
like insulin, I can't remember already if like forget the insulin already, then patient already taking the meal. Hari tu ada cakap berapa lama dah still boleh ambil insulin, but if the gap between the meal and the injection is too long, then you can no need to take the insulin lah until the next dose lah. Can't remember already, maybe half an hour, I think half an hour or so.
Dia kena sebab the insulin action, the peak.
Yeah, because of insulin action, if forgot to take and then patient take after meal, like maybe after meal 2 hours, then there's a risk of hypo lah.
Yeah, sebab because of peak time of insulin. Peak time insulin tu contohnya peak time of insulin action time tu, tapi dia tak makan waktu tu, tak ada glucose in the body kan, so dia akan risk to get hypo lah at that time. Okay, for if antibiotics same thing as well. Kalau you terlupa the dose, then you just abandon that dose and just continue the next dosage. Kalau yang 3 times lah, 3 times daily kan, macam yang you mention just now. Kalau 3 times. Kalau once daily, then they kena ambil longer lah. So yang dia miss, contohnya sepatutnya dia makan 7 hari, tapi dia miss 1 day. So you just finish the medication as well. Kena completed juga for the anti-finish lah, the medication. Antibiotics, kan tadi Imam Muhammad Hafiz bertanya about the antibiotics. So you have to take until the antibiotic finish.
Okay. Next question. For long case, should we ask for screening although not related for patients' current comorbidities? Let's say female patient age 45, should we ask for breast screening? Yes. If but you need to ask the patient when's the last, like let's say last mammogram. It's just done or 1 year ago, then not indicated lah for this time, right? So you need to know how frequent actually we need to ask for the screening, example like pap smear, breastfeeding, breast screening.
Yes.
Yeah, you can offer the screening, the preventive for the patient, every patient, example like chronic patients.
So the screening part, you can ask first whether they already did the screening or not.
Yeah.
Kalau dia dah ada buat, when it was done, and then how the result, is it normal, abnormal? So you can ask that lah. If they did not do the screening yet, so you can offer lah during the discussion to your examiner lah. So you have to mention lah, this patient did not undergo the pap smear, for example lah, tak undergo the pap smear kan. So you can advise that lah. And please remember, kalau female, remember to ask about the menstrual history. Menstrual, very important. Tapi jangan tanya, let's say the patient age 70 and then you ask when is the menarche kan. About the ni. And then dia
Ask about menopause more relevant lah.
menopause daripada menarche lah. Kan, contoh dia dah menopause for 20 years, but then you ask about the menstrual, they cannot remember, I think. 70 years old female, and then you ask about when you get your menarche and how about your menses. Maybe you can ask when you stop your menses kan, when the menses stop. That's more appropriate lah. Okay, so anything else?
No more question.
No more? So,
Doctor, I have one question.
Okay, Logan.
Doctor, I would like to ask regarding the question if let's say sees about consultation or advice pertaining to catch-up immunization. So how do we actually approach the situation and kind of like advise the mother or any parents pertaining to that, doctor?
About the catch-up immunization? Catch-up
Yes, doctor.
immunization, you mean in the OSCE?
Yes.
But in the OSCE, it is not not likely to come up because the catch-up immunization, you need to advise.
Postgrad level, that one.
Yes, postgrad level. For your level, we tak kru lah bagi soalan tu untuk you all. It's quite difficult. Okay, for the catch-up immunization, and then it is individualized because because it depends on which vaccine that actually the patient missed, and then you have to
And the current age of the child is more individualized. Yeah.
Individualized and very specific lah. So we don't think that you can handle it in the OSCE, but can come out in your other
MTF.
Yeah, MTF or SBA.
But Pro tak ada MTF kan?
Ada SBA. Okay. So in the OSCE, unlikely lah to come out.
Right. Thank you, doctor.
Okay. Tapi you should know juga lah ya, for the knowledge, for the SBA. Okay, let's say. Okay,
last question. Any last tips?
Last question. Tips, please remember to read the question properly. Okay, and then see what the information that already given in the question, the OSCE question, and then do not waste your time in asking something that not ask in the question. Read the instruction lah. Kalau contoh dia telah mention do not take history, then you
Don't
kena
take history.
jangan tanya banyak lah because that information already given. Okay, because they put the instruction there, do not take history. And then you cannot ask, you kena advise. Contohnya you kena advise kan. When you have to give advice, but you instead of giving advice, but you asking the patient question. So you cannot get marks lah kan. You tanya patient, but you not educate your patient, for example lah macam tu. Okay. So please remember to read the instruction properly. Okay, that's the tips lah. And then you can go through the topic that we actually show you just now kan tadi yang topik so. So that's actually from family medicine part. That's the thing that we will usually will ask in the exam. For the procedure, macam tadi we will show you the procedure that you actually go through, you went through already during your family medicine posting in the clinics. Okay. Also in your final year juga kan, waktu you are in the ward, that the same thing that you actually practice lah. Okay. So we will ask the common procedure that you've done, and then for the advice, we ask you to advise something that you actually need to educate your patient regarding that things lah. Okay. Yang kita discuss, yang kita practice during the communication skill, that is the same thing lah. Sama macam osce yang you went through during the semester exam as well. Okay. So I think that's all for the family medicine. So good luck for you all. Hopefully, okay. Last hint, last hint osce. More to procedure or educate, history taking, counselling, or can be both. Usually can be both, kan? Anything. So these things that you need to know lah, okay? You need to spot which one that usually can come out. Apa yang you all spot? Ada you all spot anything?
You all spot apa?
You all spot apa?
Anthropometry, contraceptive counselling, diabetic food care tak kena dah kot.
Lagi?
Pap smear.
Tak clear.
Lagi?
Doktor, kalau MDI, counselling,
Neonatal assessment.
Lagi?
Contraception, doktor?
Contraception? Lagi? Tadi dah mention the contraception tadi kan? Jangan ingat contraception sahaja tau. Sebab family medicine ni broad juga. Jangan fikir contraception je akan keluar osce. Tak semestinya.
insulin counselling, doktor.
Selling counselling, mungkin lagi. Anything else? Yang you all spot then.
Tapi insulin counselling pun maybe will come out in the medical osce, right? So baca lah. I mean just read lah. Yeah. Quick
ECG,
smoking.
doktor?
Quick smoking unlikely lah. Yes.
Unlikely. Yes.
Nice to know. Nice to know.
ECG, doktor?
ECG probably kan. ECG dalam emergency pun boleh, dalam medical pun boleh keluar, family medicine pun boleh. That's the benda yang you have to know. Kan. Tapi tak semestinya keluar lah juga. Tapi can be come out juga dalam osce di other department ke ataupun family medicine ke. Who knows? Yang tu yang you wajib tahulah. So basically you need to know what we actually listed in the logbooks tu. That's actually narrow down lah untuk you all. Okay.
BMI,
Make sure
doktor?
you know.
BMI.
Anthropometry and DMR.
Anthropometric, yes. Anthropometric. Itu pun pernah keluar dulu-dulu kan.
Doktor, drug prescription?
Apa dia? Prescription.
Drug.
Yes, dalam osce yang semester hari tu ada keluar kan yang prescription. Ada. Maybe not your group lah. Mungkin ada. So basically everything you need to know lah. Yang pentingnya is actually even though you know the question ataupun you spot kan, tapi make sure you can give the good information and you practice the correct thing lah. Jangan macam you macam contoh you advice yang incorrect things kan, ataupun perform you macam tak boleh perform langsung. And then please jangan duduk diam je kan. Bila once you diam je dalam OSCE, then you cannot get any marks. So anything you need to speak, you need to perform, you need to advise, history taking pun you need to ask. Kalau contoh history taking kan, you need to ask. So kena speak up. Kalau you just macam pause, you not talking at all, so you cannot get marks lah. Ataupun you tak perform langsung, you macam tak ada idea, you tak perform, then we cannot help you. Okay? So please perform lah. Please perform well during the OSCE. Okay? Alright.
Yeah, I read the instructions and then usually, I mean, the instruction will give you, you know how many tasks that you need to do, right? Maybe first, you counsel first, and then second, you manage. So you try to allocate your time lah. Usually for undergrad, I think it's simple one. I mean, not very complicated. You still got enough time to finish. Yeah.
And then instruction tak semestinya ada satu je instruction.
Yeah.
Perhaps ada dua. Then you kena tengok betul-betul. Sebab kadang-kadang instruction tu very specific kan. For example, you have to do this. And then the second thing, you have to do this. You kena do both the instruction tu. If you miss one instruction, then you cannot get marks on that other instruction.
Yeah, usually examiner won't remind you. You will keep quiet there and then just wait for the time to finish. So please, I mean, be focused. Yeah. Like last time, semester exam, right? Endoprometry and then plot the growth chart. So after you try to allocate your time lah. Yeah.
Contohnya macam tu kan. So you follow the instruction. Okay. Once you finish the first instruction, then you go for the second instruction. Okay, instruction usually the perhaps ada 1, 2, sometimes 3 instruction. Then you have to follow one by one. Make sure you cover both. You cover all. Okay, so that you can get the marks lah. And then please perform lah. Kalau you senyap je, you tak buat apa-apa, then you will get any marks for the instruction given. Okay, that's the tips lah. Alright. Okay, alright. So hopefully you can, you all pass for your exam. Okay, successfully. Okay, not only in family medicine, but the other posting, the other station also. Kan, the other station, the other components, all the components, you all pass. Okay, and then you can grad, right? Okay, so you become the doctor after this and become my colleague perhaps later. Okay, you will see us again. Again, maybe you will see us as your patient ke, will see us as your colleague ke, alright? Okay. Alright, okay.
Good luck. Good luck.
Okay, good luck. Okay, alright.
Thank you, Doctor.
Okay, welcome. Hopefully we'll
Thank you
help
so
you
much,
all.
Doctor.
Okay, alright.